Hello everyone, Lois Frankel here, member of Congress from South Florida, and we have a very important subject to talk about because this week is Fall Prevention Week in the United States, and I have a fabulous, experienced guest who knows all about the subject. Tori Goldhammer is the Clinical Manager of Home Care Partners here in Washington, D.C. And Tori, thank you for being with us.
Thank you for having me.
I'm going to have some questions for you, but I want to start with telling everybody why I actually got involved in this subject. I have a 97-year-old mother, and let me start by saying she is alive and well now. She was living independently, fully sharp, better memory than me, and one night, in the middle of the night, she had a fall. Fortunately, she was wearing one of these Apple Watches that actually called the paramedics. It turned out she had broken her hip, her leg, and it really started a year-long recovery. And it was almost a miracle, because I know, Tori, as you will explain, when older people fall, especially at that age, it's usually a downward spiral. But I started investigating what the impact of falls are on older people, because once my mother fell, people were just coming up to me and saying, oh, my mother fell, my sister fell, I fell. Going, wow, a lot of people seem to be falling. Then I fell and I broke my finger. I mean, really, it was so I got obviously very curious about this, and I saw my mother's bills piling up. She fortunately had Medicare, and I saw the rehab bills. And then now she's in a assisted living facility. So then I found out through my research that there are 36 million falls a year for people over the age of 65. That is the leading cause of injury. Also thousands of deaths and just a loss of independence. And so with that sort of introduction, Tori, let me ask you this. First of all, tell everybody what you do.
Thank you. So I'm an occupational therapist, and I work for a program here in Washington, D.C. with our focus is on helping to reduce the risk of falling in people's homes. So I assess people for their fall risks and try to figure out what interventions we can propose so that they can reduce that risk of falling.
So tell people why it's so important to prevent a fall, especially for people who are getting older.
Right. Well, so exactly like you described, your mother's course of medical course is unfortunately typical. Prior to working at Safe at Home, I worked at Georgetown Hospital for 10 years, and we saw a lot of people that had come in for falls. And it is very scary when they end up in the hospital. There's other complications that might happen because of the inactivity and just the rehab, as you mentioned, for your mother. So we really want to prevent that. And the good news is that you can really reduce your risk of falling, and it's actually not that hard.
That is why we are here today,
yeah.
Because I don't think people realize that there's so many things that you can do to prevent a fall and that we must do. So why don't you just tell us some of the things we can do, and then I want to hear a little bit more about your process when you're at work.
So there's 4 categories, according to the Centers for Disease Control, that contribute to your risk of falling. So one of them is medications. So obviously your medications, they might contribute. You might have some side effects from your medications that make you dizzy, that make you lightheaded, that might make you dehydrated. So you need to make sure that your doctors and your pharmacists know all the medications you're on, and if you're having any side effects from them. That's a very important conversation to have. So this was a great story I heard last week from a colleague. She worked at an assisted living facility, and what they did was they encouraged the residents to drink more during the day. And they saw from one year to the next a 76% reduction in the number of falls as a result of just the hydration program. It's pretty remarkable.
Gotta drink some water.
Yeah. The second one is vision. So at a minimum, you should have your eyes checked once a year, at a minimum. The third is your environment. So making sure you don't have anything on the floor like we already talked about, right? Like, if you have grandkids in your house, make sure that there's not a toy or something in front of you that you're not expecting. Watch out for the pets, those kind of things. If you have things on your stairs, make sure that they actually get to the top of the stairs if that's your plan, and not to leave things in your way. And then the fourth category is balance and strength, of course, right? Because you need to have strength and balance to not be at a risk of falling. And there's actually a lot of things that you can do, simple things all the way to full-blown exercise programs that you can do to reduce your risk of falling. The other thing you can do, another research thing that's happening right now is the idea of mindfulness. So being very aware of your body and how you're feeling before you start to walk. So I recommend for people when they sit up in the morning to just kind of like gather themselves, right, for a second. Make sure you're not dizzy or lightheaded. There's no new pains or no new shortness of breath. So just take a moment to gather yourself and do a body screen. And even when you stand up, do the same thing, because being mindful is good for you, regardless, it's good for you, but also it's good for you to pay attention to your surroundings and yourself.
There are a lot of players in this, and so it's important that our physicians are properly screening their patients.
Yes.
And that's whether it's an eye doctor or an intern or so, whoever is really having contact with someone. We're going to talk about what you do first,
okay,
which is the home assessment.
Right.
And how common are falls in the home?
So about 60% of all falls happen in the home. And that's important to know because a lot of people will tell me that they're not leaving their home because they don't want to fall. And in fact, it's more likely they're going to fall if they stay at home for a lot of reasons. So
that's it. Well, that's right. My mom was in her home when she fell.
Mm-hmm.
So
Yeah.
okay, so tell us, you're called to a home, mm-hmm, and you do an assessment.
Right.
Tell us how that goes and what you're looking for.
Okay, so what we do is we try to be very comprehensive. So we look at all 4 of those categories. So we review medications, we do a quick vision screen, we do a quick balance screen, and then we walk around the home with the person. So we take a look at the most obvious areas, which of course are the stairs, to make sure that they can get up and down the stairs, that they're properly lit, that there's no hazards on the stairs, that there's railings. And if they can't go up and down the stairs, there's other options. We take a look at the bathroom. It is essential for people to have grab bars in their bathroom, no matter the age. You know, I actually put them in my bathroom when my daughter was 5 because she couldn't step over the side of the tub. And the truth is they've been useful ever since then. So grab bars in the bathroom, absolutely. Good lighting, removing any objects on the floor, rugs that might trip you up, cords that are going across the doorways. There's just a lot of things that you can do. And once we're done looking through the house, we come up with a list of things that we can do. And fortunately in DC, there's a grant program, so we can implement those things for the homeowners.
That's terrific. So, because how much, if somebody wants to get a grab bar, they get an assessment, are these items costly?
Well, that's a good question. So the grab bars themselves are not necessarily costly. Now, there's a variety of quality, but you might be spending $30, $40 on the grab bar itself. It's the installation, obviously, that's key, right? Because you don't want those installed incorrectly because then it's pointless, right? So here in DC, if you get 2 grab bars installed, the price is anywhere from $250 to $350 to have 2 bars installed.
Now, does your grant program pay for that here?
It does.
It does. Okay, so this is I'm going to put this on the to-do list because we really need to have more grant programs across the country. Yours is a local grant program.
Correct.
Right?
Yeah.
Okay. Now, one more thing. I was thinking about the stairs. There are certain things that you can do to, like a chair lift, something like that.
Yeah. So what we try to do is, if you can walk up and down the stairs, the best thing you can do is put railings on both sides. That, by research, has been proven to reduce your risk of falling.
And hold on to the rail.
And hold, of course, yeah, of course. And wear shoes. Actually, you know what? Almost more important than anything is wearing shoes in your home.
Okay.
Yeah, we meet a lot of people that just wear socks. And you know, if you're on a wooden set of stairs and you're rushing, you know, that's just a recipe for disaster, no matter how old you are, right? So
that's another really good tip.
Yeah, yeah, absolutely. Wearing shoes in the house all the time is very important. Staying hydrated is very important. These are easy things that we can do without having to adapt our home, yeah.
And if you have or need a walker, you should use it.
Oh gosh, I'm so glad you said that. That is so important. How many people I meet that have been prescribed a walker or a cane and they don't use it in their home because they're comfortable in their homes, right? So they rely on furniture and on walls. But yes, if you've been given a walker or a cane, you must use it inside and outside your house.
And you maybe don't have one yet, but you may need one.
Right.
And who would assess that?
A physical therapist. Yeah. So there are some things that might indicate why you need physical therapy. So for example, if you used to be able to, say that chair that you're sitting in right now, if you could easily stand up from it and have no trouble, and then you're starting to notice that you're having more difficulty standing up from that chair or from the toilet maybe, that's an indication that your legs are getting weaker and a good time to get an assessment by a physical therapist before it becomes a problem, right?
Or can they go to their regular doctor? I know a lot of people probably don't even have a physical therapist.
They can start at the doctor, and that's a great place to start because they'll have to write the prescription for the physical therapist anyway. And the other thing that the Centers for Disease Control has on their website is something called the STEADI tool. It's STEADI. And I'm sorry, I don't remember what it stands for, but it's an acronym for something. But it's really nice. It's for physicians to use, and it has a protocol for them to follow if somebody has reported a fall. So it's a really great tool for physicians to be aware of.
You just given us a lot of good ideas, not only for the individual, but for their family and friends and for our physicians.
Yes.
And anybody who's having regular contact with someone who is older. You also know that as people get older, some of them start to have memory issues, not quite able to have the clarity that you're talking about. So what do you suggest to help those folks, or for people who are around them? What are your suggestions?
So we do work with caregivers a lot, so that's good. In that situation, the environment becomes even more important, right? Because we really need to make sure the environment doesn't have any hazards, like you said, that they may not be aware of. Yeah. So really making sure the environment is as hazard-free as possible. If necessary, we put in monitors or different ways to alert a caregiver if somebody is moving and they need supervision for that. Sometimes we have to have somebody stay on the first floor of their house just so that they're avoiding stairs. So it sort of depends on the level of cognition and the level of caregiving that they need, but there are certainly solutions, and in that situation it's really important to work with a therapist who specializes in that.
All right, so I think we should maybe have to have rules right here. So number one is there is a lot that you can do for yourself to avoid a fall. Lots of things that physicians can do. But I was having rule number two. If you have someone who you love, you care for, or a friend who maybe has a memory issue, but they're getting to that age where they are at risk for falls, go be their hazard police, right?
Yeah.
Go check their home, look for the hazards, make sure they have the grab bars, and make sure that they're getting hydrated.
Yeah.
And not being over-medicated. I think those are some of the things you suggested.
Yeah.
And then, of course, there's the exercises, which we'll get to in a moment. So for folks who live in Washington, D.C., or they're fortunate because the D.C. has a program that you're running that really is a fall prevention program. For people in other localities, if they're looking for a program, do you have a suggestion for them?
Generally, the place to start is what's called your area agency on aging.
All right. Well, listen, Tori, we have a great program starting in Palm Beach County with the Delray Fire Department, and I think our Palm Beach County Fire Department does something. But what they're doing is they're also doing home visits, similar to yours, making assessments, and they're putting lock boxes on doors with the homeowner's key, with their permission, so that if they are called to an emergency, they can get into the apartment. But the purpose of this conversation is, let's not have any emergencies. We can prevent falls. There are many, many things that someone can do, an individual or their physician, or people, if you come in contact with someone who's older. Tori's given us a lot of tips. And let me just say this again from my own experience. I wish I would have had this conversation with you over a year ago, because I think we would have come up with a plan that would have prevented my mom from falling.